Dear patient, if your eyelid is doing like this, blinking uncontrollably, this condition is known as eyelid myokymia or eye twitching. Now, what is eyelid myokymia? Eyelid myokymia is an involuntary contraction of the upper eyelid and occasionally the lower eyelid, meaning that it is commonly seen in the upper eyelid than on the lower eyelid. Now, what causes eyelid myokymia? What causes eyelid myokymia is when the muscles of the eye is excited. The muscles of the eyes that is responsible for closing the eyes. This muscle is known as orbicularis oculi muscle. Forget the big grammar. Now, this muscle is the muscle of the eye that helps you to close your eyes, and it is being innervated by the cranial nerve 7. At the back of your head, there are 12 pairs of cranial nerves, and the 7th one is known as the facial nerve. This facial nerve is the nerve that transmits information to this orbicularis oculi muscle. Now, when this nerve is overactive or overreacting, it can stimulate the eyelid to start blinking uncontrollably. What causes excitedness of this nerve? That is the facial nerve. What causes it is your habits, the things that you do, which include eye strain, which is usually from prolonged use of or exposure to screen, which include your phone, your laptop, your TV, anything that has to do with screen. When you spend long time on them, it can lead to eye strain, and from eye strain, it can lead to eyelid myokymia. Another thing that can cause eyelid myokymia is fatigue, or you're not getting enough sleep. When you're not getting at least 8 hours of sleep, it can lead to eyelid myokymia. Another thing that can cause is stimulants, especially those of you that take caffeine, smoking, as well as when you are stressed. This can lead to eyelid myokymia because they trigger the nerve that innervates or stimulates. When you hear innervation in medicine, we are talking about stimulate. They are what gives information to the organ or cells they are assigned to. Now, this facial nerve, when you're not getting enough rest, or you're not sleeping well, or you're exposing your eyes for too long on a screen, it can trigger this nerve to be overactive, which in turn lead to overstimulation of the muscles they are assigned to, and this is what leads to eye twitching. Now, how do we manage this in the hospital? First of all, it is very important for you to note that this is not a serious eye problem because they can stop on their own without you needing treatment.